All right, good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is August 2nd, 2022, and as always, this is your chance to get public health questions answered. We will be talking about COVID, we will be talking about MPV or monkeypox, and we'll be talking about whatever other questions you ask. So as always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. And let's go ahead and dive right into the data and then some slides, and then we'll take your questions. So first of all, chi.gov/COVID- is our COVID dashboard for the last more than 2 years. And if you take a look, no major changes here. You see our cases are down just a touch from last week, but still quite high at 784 a day. Hospitalizations also down just a touch from last week. Deaths also down just a touch. So all of that is good. Still doing about 2,000 vaccinations a day. And about 3% of our emergency room visits are people with COVID, and a little less than 5% of our hospital beds here in Chicago are occupied by people with COVID. That is up just a little bit as we're seeing folks who perhaps were infected a week ago now in the hospital. I also just wanted to highlight, for those who may not have been following, chicago.gov/monkeypox or MPV. This is that page, and we've got the contact numbers right at the top if you've got questions, but we also are now updating Chicago's MPV cases every day. So you can see here we are up to, or every weekday, we're up to 434 cumulative cases and 20 cumulative hospitalizations, so no major change in terms of how many people have been hospitalized. No deaths here in Chicago, and you can see the way that's been growing. This chart shows the week that ends on a certain date. So this, for example, is the week that ended last Saturday, and then this week is great because we'll still have additional cases reported, but you can see that numbers are definitely continuing to grow. We've also included some of our demographics here, and I'll go over those in just a second, but I just wanted to show you that this is now available, and thanks to my team for working quickly to have this become something we're updating even more often. There's also a lot of information on here about all kinds of things, vaccines, monkeypox, and we're working on making what's called a microsite, where it's the layout is a little cleaner, etc. So keep coming to this site for questions about COVID or monkeypox. And let me go ahead and pull up some slides. And we'll start with a monkeypox update, just based on the questions that have been coming in, of which there have been a lot. Let me just get this pulled up. There we go. Okay. So to start with MPV, just again with the basics. How is MPV spread? It's spread through close contact, especially intimate contact, kissing, sex, or other skin-to-skin contact with someone who has the MPV virus. What are the symptoms? A rash or sores may appear anywhere on the body. That includes the genitals. Sores can look like pimples or blisters. They're literally pocks. Also, many, but not all people, have flu-like symptoms like fever, chills, headaches, or muscle aches, and those can occur sometimes in the day or two before a rash or sores develop. Who is at risk? Anyone can get MPV because it is literally an issue of having this close skin-to-skin contact with someone who has a sore. But from the data here in Chicago, across the US, across Europe, gay, bisexual, and other men who have sex with men have made up by far the majority of the cases, and that remains the group in which it is spreading the most. So what should you do? If you or your sex partners feel sick or have a rash or sores, please don't have sex or other close physical contact, and don't kiss or touch each other's bodies while you're sick until you get checked out, know what's going on with that rash. Also, don't share things like towels or sex toys or toothbrushes. Wash all of that, and then call your health provider right away if you have symptoms. We've got information. If you don't have a provider, not sure where to go, don't have insurance, we can help get you connected to care. So if you think you have monkeypox, what should you do? Isolate, separate from others, skip gatherings, don't share personal items, call your doctor. Remind them that MPV is in the community. Any doctor can do a test, and we want folks to be getting tested, no matter who they are, if they've got this unusual rash. The big question we've been getting is, how do I calculate this risk? What is the risk of being exposed, for example, at the grocery store, on a busy coffee shop, on a CTA train or bus? So based on everything we know now, monkeypox is not spread through casual conversations or by walking by someone with monkeypox like you might in a grocery store. It is not as contagious as influenza or COVID. You don't become infected by just being around infected persons unless you have prolonged close contact or share bedding or clothing, for example, with someone who has MPV. So we might be concerned about household contacts if they have a lot of close contact, but really we've seen spread through intimate, sexual, or kissing activity. So here's what the MPV outbreak is looking like globally. We're up to almost 25,000 confirmed cases in 80 countries. You see in blue there are the parts of the world that historically report monkeypox, where it is endemic. It's historically been a disease that is spread by rodents, and if people are in contact with rodents, prairie dog-like animals, etc., that's how historically people have gotten MPV. But this new outbreak that has been spreading much more person to person, and especially through sexual networks, as you can see, has been all over the world at this point. In the U.S., we're up to almost 6,000 confirmed MPV cases, and Chicago's current case count is at just over 430. So we continue to have a little less than 10% of the cases in the U.S. here in Chicago. It is the large cities where we have seen the epicenters of these outbreaks. And again, it's about where social networks, and especially given that this is primarily being seen in the networks of men who have sex with men, Chicago is very much the epicenter of the outbreak in the Midwest. I already showed you this on the website, but again, you can get there at either chicago.gov/monkeypox or chicago.gov/MPV, and you will be updating this every day. So here's the demographics, again, from the website. So consistent with all of the weeks to date, most of our cases have been in people aged 25 to 34. You can see 42% there, followed by people 35 to 44, 45 to 54, etc. Our youngest case is still 22. Our oldest case is still 66. We do think that in that younger group, 18 to 24, people may be less likely to be seeking testing. We know that young people, older teenagers and young people in their 20s sometimes don't have a primary doctor or might not be as likely to seek care. And so just want to encourage people of any age, especially if you have some of the known risk factors, to go ahead and get tested. If you see the race ethnicity breakdown here, Chicago is about 6-7% Asian, so we're seeing a little bit underrepresentation there right now. About 3% of our cases have been in Asian non-Latinx Chicagoans. We're a little bit less than 30% Black non-Latinx Chicagoans, and only about 13% of our cases. But again, we think some of this is probably whether people are as likely to be getting tested. So really important to be getting tested. The numbers are growing every day across all of these groups. We're a little more than 30% Latino and 29% of the cases, so that is matching what would be expected. And then we are seeing an overrepresentation in white non-Latinx Chicagoans, both because of spread in networks and probably because more of those folks may be getting tested. So you see there's also about 8%, there's 1% are other, but non-Latinx, then 8% are unknown. And then if we look at the demographics, sex refers to sex assigned at birth. All but one of our cases at this point have been in people assigned a male sex at birth. If we ask about gender, this is self-reported at the time of care or during our interviews. You see, again, that 2 people are reporting woman gender, and then sexual orientation. The great majority have been in people reporting gay or lesbian, followed by bisexual, but there are a good number here unknown as well. And sometimes that's because the case doesn't provide it or the case hasn't been reached for an interview. But I just wanted to share some of the data of how we know that this remains the group at highest risk. And so just to sum that up, most but not all of our cases have been in gay, bisexual, or other men who have sex with men. The median age is 35 with a range from 22 to 66 and spread, again, primarily through skin-to-skin contact with rash and lesions. If you have a new or unexplained rash, go to your healthcare provider. You need to see a healthcare provider to get the diagnosis. If you were to need treatment, you would get it through that provider, and that provider can help. You know, the provider, we get the information at the health department if your test is positive, and we'll reach out to do case investigation and contact tracing in a way that protects your privacy. This on the right just shows you some of the examples of the rash. So our overall MPV plan, M, is about monitoring. What are our cases? What is our case investigation? What is our contact tracing? What's happening with testing? P is providing resources and education to clinicians, community groups, business, and the public. And then V is vaccinate those at highest risk. Tests are widely available. I really want to emphasize that. Our top line message is that anybody who has one of these rashes that could be consistent with MPV can get tested at any health provider. It doesn't have to go to a public health lab. Swabs of the lesion get collected, and we want you to get tested if you have symptoms. There is also treatment available for higher risk patients, patients who are hospitalized, patients who are immunocompromised. That also is prescribed through healthcare providers. We have seen testing really ramping up significantly, which is good. That's part of why the numbers are growing. More people are getting tested, and I'd love to see even more people get tested. Vaccine is also increasing. There's been a lot of conversation about this. We've been answering a lot of questions here, and I wanted to just make sure I've set this up for everybody so you're getting the information directly. So there is an FDA-approved effective vaccine against MPV called JYNNEOS. It is designed to help protect individuals who have been exposed to someone with MPV. So this is a vaccine that you can get even after you have been exposed that can significantly decrease your risk of developing monkeypox or MPV. So ideally, after a known exposure, we're getting the vaccine to close intimate partners within about 4 days, but we will definitely administer it up to about 14 days to help limit symptoms and decrease the risk of spread. But this is, at this point, not something that is recommended for people who have not been exposed. The vaccine really is in limited quantities in the Strategic National Stockpile. It's a pretty rare disease before this current outbreak. So the U.S. is working on getting more, but so is the rest of the world. And I just want to be clear that all the vaccine that is available is distributed to Chicago, to Illinois from the federal government. So in the first weeks of the MPV outbreak, when there was very little available federally, Chicago and our partners, we did a lot of advocacy, really appreciated being prioritized for vaccine from the federal government, and we received and distributed about 5,000 vaccine doses. For some context, remember I just said even now when demand for COVID vaccine is low, we're giving out about 2,000 COVID vaccines every day, and that's ranged between 2,000, 3,000, up to 5,000 when demand has been low, and much, much higher than that when demand is high. So it really has been primarily just an issue of supply. We got about 15,000 additional doses from the federal government allocated to and arrived in Chicago just over a week ago. So that's been helpful. That's 3 times more than we'd gotten to date. We've been distributing those daily, by the thousands, and as quickly as they get here, we get them out through partners. We are expecting additional federal vaccine doses, about 13,000 more, to get here to Chicago over the next 1 to 2 weeks. We were able to place an order yesterday. We'll see what that timing is, and then in total, the federal government has said that they are expecting, with what is available now, a total of about 33,000 additional vaccine doses. Jurisdictions have to show that they are using the vaccine that has been allocated before more is sent. But that's not really our issue here in Chicago. We've got plenty of demand and a really strong distribution system. It's just about having enough vaccine. And so the U.S. has placed orders for millions more vaccine doses, but that's really an international order. And realistically, I think we are a few months from deployment. So where you look at this is more than 50,000 doses, which is good. But we estimate somewhere in the vicinity of about 120,000 men who have sex with men in Cook County. And Jynneos technically is a 2-dose vaccine, meaning half that many could get the full dose. I want to appreciate Illinois Department of Public Health and the state that have redirected some of the federal vaccine supply that came to Illinois. Of course, it's getting sent around the state for where there are cases, but given that the epicenter is here in Chicago, the state has also redirected some additional vaccine here, and that's appreciated and the right thing to do from a outbreak control perspective. I talked about this last week, so I'll refer you to the slides from then, but we are using this ring vaccination strategy where the top priority is vaccinating all contacts of cases, meaning intimate, close, sexual type contacts. When you do this, if you do this effectively, it's the best way to stop an outbreak. But the challenge is sometimes people, if they've had multiple partners or maybe they're meeting folks through apps, et cetera, are sometimes not able to name all of their contacts. And in that case, we are also vaccinating some of the individuals who would be at highest risk with an assumption that they may have recently been exposed to monkeypox, even if they don't know. So supplementing CDPH contact tracing, I wanted to just highlight there's a website called tellyourpartner.org, which is available for a whole range of sexually transmitted infections. MPV is not just a sexually transmitted infection, but we are primarily seeing it spread through people having sexual or intimate contact. And so I just wanted to raise this, that if you go to tellyourpartner.org, it's a simple platform that lets you anonymously notify intimate contacts about your diagnosis of any STD via text message. It doesn't show your phone number, it doesn't identify you, but you do need your partner's phone numbers. And then it lets your partners know that they should get tested or be aware of symptoms. And so just wanted to highlight this. We've been messaging hard that right now, more than ever, it's important to make sure that if you are having close, intimate contact with anybody, that you know how to contact that person again. So be getting a phone number, even if you might not always do that. If either of you are diagnosed with MPV, we can then reach to that partner, their partners, in a way that protects your privacy, but gets vaccine where it is most needed and gets the information to people to help prevent further spread. So right now, you are eligible for an MPV vaccine in Chicago if you, number one, top priority, had close physical contact with someone or an intimate partner who was diagnosed with MPV. There are no restrictions on that. You don't have to be a man who has sex with men. You don't have to have any other requirement. If you are a close contact of someone diagnosed with a test with MPV, that's the top priority in that ring vaccination strategy to get you vaccine. And then secondly, we are making vaccine available, given that we don't have enough for everybody who wants it, to gay, bisexual, or other cis or trans men who have sex with men who also have an additional risk factor, one of these three: having intimate or sexual contact with other men in a social or sexual venue, have given or received money or other goods in exchange for sex, or have intimate or sexual contact with multiple or anonymous partners. And so we've been working with a lot of providers, a lot of sites, a lot of places where we've seen higher risk activity or spread. And as more vaccine gets here, we expect to be able to open that eligibility up further. So again, just to underscore, at this time, MPV vaccine is not recommended for the general public. I have not had an MPV vaccine. That includes same gender loving men who don't have other risk factors. Okay? As vaccine supply increases, this guidance almost certainly will evolve. We also, and I talked about this last week, we made a decision to prioritize first doses of that Jynneos vaccine at this time. The vaccine is labeled to give a second dose at least 28 days after the first dose, but where our team and others have looked at the data behind this, the biggest increase in protection comes after that first dose. And we know that delaying the second dose doesn't affect that second dose immune response. So taking the same approach as some other countries and some other cities here in the US, after the initial 5,000 moving forward, we are using those doses primarily as first doses to offer some protection to more at-risk individuals. We are still offering second doses to immunocompromised individuals and to known contacts of cases. But this is just a way for us to try to stretch out the vaccine that we have without significantly increasing individuals' risk. And then as more comes, we will offer second dose to everybody, but it may be even a few months down the line. Lots of planning happening with Market Days, which is next weekend. We've delivered businesses, palm cards and posters. We've got banners we will have banners at the gates, messaging for travelers, etc., encouraging self-awareness, screening, behavioral changes, ways to limit the risk. We've got a video campaign going in LGBTQ+ bars. And then these Market Day video screens, again, early symptoms, behavioral changes to limit risk, stop the spread. We're going to have some of our Health Corps members, just like we've done for COVID, where we have large events. As opposed to standing up a vaccination clinic, there are partners who will be doing some vaccination, but I just want to set now, we don't have enough vaccine to be able to stand up, large come one, come all type sites there. So, I would encourage Chicagoans, to be getting vaccine now, but we also, knowing that there's some more coming in the next 1 to 2 weeks, we are intending to distribute information that will let Chicagoans sign up for additional vaccine appointments that we expect to be available over the next 1 to 2 weeks. And again, once we have a sense of when more vaccine is coming, I just want to set the expectations that we're working hard to make sure highest risk people can get vaccinated, but we've been working to make sure those opportunities are available across the whole city. And of course, my top priority is making sure that Chicagoans, people who live in Chicago, can access vaccine. So Mateo Lane is a really prominent comedian, just ranked one of the top 10 comedians in 2022. He's doing a PSA for us. Really appreciate that. And lots of other things happening, not just for Market Days, but around making sure that the highest risk population has the information. So you may see things about, it's time to talk. This is something we want people talking about with partners, with providers about monkeypox. You'll see some messaging, turn on the lights before you turn off the lights, meaning if you're having sex, spend a little time with partners. Make sure you're not seeing any rash or sores. Don't touch those, right? And then, more to come. So on COVID quickly, and then we'll get to your questions. Still very much in the worldwide outbreak here. We are over 6.3 million deaths across the world and more than 572 million cases. Also 12 billion vaccine doses have been administered, and it's just been amazing to see how this has helped turn this disease from one that is really deadly to one that, although there are still deaths from COVID, it's nothing like it was prior to the vaccine being developed. Here's what the U.S. looks like right now. Darker areas mean a higher number of cases per population being formally diagnosed. Remember, this won't necessarily include people who are diagnosed through home testing, which is most of it. But anybody who's sick enough to come to emergency department, come to a hospital, or getting tested through providers' offices, it shows up here. We've had more than 91 million cases, more than 1 million deaths. And you can see Chicago continues to have rates that are under both the national rate and the rate in Illinois. Southern Illinois is surging a little more right now, you can see. And then down in like Louisiana, Alabama is where we're seeing a significant outbreak right at the moment. In last week's CDC update, 81% of U.S. counties were either high or medium, orange or yellow. You can see that's also true in Illinois. And we do remain at this high level. You can see City of Chicago and Cook County both have more than 200 cases per 100,000 population. And then the City of Chicago, our hospital admissions really remain quite low, just 4.5 per 100,000. But Cook County and the hospital catchment area overall in the region is over 10. And so the combination of those two is what continues to keep us at this high level. And we do, recommend being careful, recommend testing, recommend masking indoors. None of that has changed. Here's what's happening with variants. Like, it is all Omicron and now nearly all BA.4/5. You see here that BA.2 across the Midwest and across Chicago is less than 3% of the cases. Everything else is BA.4/5. And you can see in that darkest green in the week that just ended, July 30th, almost 87% are that BA.5, and then another 10% or so are BA.4. And BA.5 is the most contagious version yet, right? I'd say one very small piece of good news is that we haven't seen the emergence of a new variant clearly outpacing that. You know, every week when we look, you might find individual cases of something a little different. We worry about them if they start out competing or if they're more serious. So the good news is that the updated COVID vaccine is meant to cover BA.4/5, which is good. So that's where we are. And if you look at the US, similarly, everything's green, right? It's that BA.5, and that's why there's been so much COVID infection. It's the quickest moving yet, most contagious yet. So just a reminder, if you catch COVID, regardless of your vaccination status, you need to stay home for 5 days. If your symptoms are resolving or gone by day 5, you can leave your house, but you must continue to mask while around others for days 6 through 10. We're seeing some examples, especially with BA.4 and 5, of people testing positive for longer, occasionally testing negative and then positive again later. We actually saw that with President Biden, for example. You've got to wear that mask for days 6 through 10. And I don't anticipate that guidance changing anytime soon. And then just a reminder, you really should have gotten your boosters. And I want to emphasize, I'm guessing people will probably have some more questions about vaccine, but we are anticipating a fall updated vaccine, and it may be as soon as mid-September, we're hearing. And so knowing that there could be an updated vaccine as soon as mid-September or October, that's earlier than I had thought. I was more expecting it to be October, November, but we're hearing preliminarily that they may be done and produced and rolled out a little bit ahead of schedule, which would be good. I don't want people waiting to get their booster of, against the original. The last thing I want is you getting a booster on, August 31st and then getting this new vaccine September 15th. Now is the time, truly, to get that booster. So anybody over the age of 5 should have had a vaccine booster at least 5 months after completing their initial vaccine series. So everybody over 5 should have had 3 vaccines, and anybody over 50 or moderately to severely immunocompromised really should have had 4 by now. And that's separate from what's the updated vaccine happening in the fall. This is available on our website. Every day we update it, and you can see what's happening by age, race, ethnicity, geography in Chicago. About 12,500, still only about 8% of our littlest Chicagoans have gotten a dose. And I'm worried about that, frankly, heading into the fall, knowing that, I just want daycares and preschools. I want these open. I want early childhood education happening. I don't want disruption. When your little ones are vaccinated, it means we're not needing to do quarantine, we're having less chance of spread, et cetera. So, really encourage people ahead of the fall to be working on that. And this Saturday, we'll be at Truman College and Malcolm X College for our family COVID vaccine clinics. These have been going well. Last weekend, we did more than 300 vaccines, adult and pediatric vaccine doses and boosters are available. Encourage you to register, but we do take walk-ins. It's Pfizer. We've got Pfizer in all the variations for all ages, and then for ages 6 months through 4 years, we also have Moderna. And then finally, our Protect Chicago at-home program is also still going strong. Anyone age 6 months and older in Chicago can get a free COVID-19 vaccine at home, no questions asked. It doesn't matter where you live. It doesn't matter what your income is. If you want a vaccine, City of Chicago will bring it to you at a time that is convenient for you for free. And that includes Moderna for the little ones and then Pfizer. And then if people who need a booster, we're happy to bring boosters of the Pfizer vaccine. We'll do up to 10 people at the same time. And right now we have appointments Saturdays, Sundays, Mondays, and Tuesdays, starting at 8 a.m. and going through 6:30 p.m. We also continue to have some $50 gift cards available for booster doses. And then in certain zip codes listed there, the $50 gift cards for each dose of primary vaccine, just, making, helping people prioritize if they need to have childcare, whatever it might be, that we have extended through August 30. And encourage people now, please, while we're at this high risk, while there's a lot of COVID out there, now is the time to get your vaccine and get up to date with your booster. So if you need a vaccine or a booster, you have any other COVID questions, nothing's changed, call that number. And if you have questions about monkeypox, chicago.gov/monkeypox, or you can call our same number. That team has information, can help get people connected. But also, I wanted to point folks to our HIV/STI resource hub, which is also focused for LGBTQ health. And so if you've got more specific questions, you can also call that number. The 312-746-4835, we continue to staff 7 days a week into the evening. The HIV/STI is more of a weekday during regular working hours. But regardless, please reach out if you need help, if you have questions. And then finally, I wanted to highlight that next week, next Tuesday at 11 a.m., we are planning to have CEO Pedro Martinez of Chicago Public Schools on with me, and we will be talking about COVID-19, vaccines, and Chicago Public Schools, all things schools. It's always possible that could change because we're both busy people, but that is the current plan. And either way, I know that CPS next week plans to be sharing some additional information about some planning, and I have a lot of confidence in what they're planning. So I know a lot of you have had questions, and I wanted you to know that next week we will be addressing that. Okay, let's get into your questions. Oh, thank you. So I'm going to start with a nice comment because I like it when there's nice comments from my team. Aaron Hoffman from Facebook says, just a comment. I work for a large health system in the Chicago area, and we've treated several MPV patients. CDPH has been wonderful to work with as we navigated the process for obtaining TPOXX, that's the treatment, and helped walk us through every step of the way. A big thank you to your staff. Thank you, Aaron. My team is working a lot. This has been a big strain on healthcare providers, too. For people to get that TPOXX, that treatment, there's a lot of paperwork that has to be filled out because this is a treatment that was actually developed more for people with smallpox than for MPV, and so it's still, there's extra paperwork while they're working with the FDA, et cetera. And so we know it takes a lot of time, and we've really appreciated the way all over this city our healthcare providers have been working hard to get people tested, get people treatment, and really create environments that are as free from stigma as possible. I was really happy. We've had MPV diagnoses made in almost 50 providers' offices across the city at this point. And that's a good sign to me that it's, many of the diagnoses have been in some of the providers that are especially focused on LGBTQ health, as you can imagine. But most have actually been in primary care offices, and that's exactly what we want. Providers being on the lookout, patients knowing that they can go and get testing, and then the providers working hard with the health department supporting. So thank you for that. Okay, so a number of questions here about risk level. Let me kind of hit a few of these. So at Emancipated N in 1 on Twitter says, how can we keep safe from monkeypox? So it depends a little bit on what risk you might have. If you are a man who has sex with men, you should know that that is the community that we are seeing the most spread of this virus in at the moment. If you have a single partner and nothing has changed, there would not be a significantly increased risk there. But I do think, right now is a riskier time to be having more intimate partners or to be especially having anonymous sex or intimate contact. And so would strongly encourage knowing that the highest risk is people who are having intimate contact. Just as we said, turn the lights on before you turn the lights off. Be having conversations with your partners. If either of you have a sore, go get diagnosed before you're having that contact. And then I think more broadly, if you're not a man who has sex with men, especially who also has other risk factors, the risk is not high right now. The risk is not high broadly to the general public. The risk is also not high to MSM without contact with a lot of other folks. But it is true that this is spread through skin-to-skin contact. And so just being aware of how it is spread and having awareness. And then generally, if you're not feeling well, go get seen by a doctor, especially if you have a rash. Drake Mean says, I need to go shopping for back to work clothes. Is it okay to try on clothes? Yeah, good question. It is absolutely fine to try on clothes. Where we have seen this spread, and we have very occasionally, I want to be clear about that, we have occasionally seen some transmission. It's really been when people have had active sores and then usually had close contact. So for example, with bedding or sharing towels in a household setting, I do not have a high concern given the number of cases that we have, general risk factors, et cetera, that trying on clothes would be a source of spreading MPV. So that is not a worry for me at all at the moment. Okay, let's take a couple of MPV vaccine. And actually, let me start with this one. Mary Cruz Torres from Facebook says, where can one get tested for MPV or be seen by a provider if they don't have insurance? So lots of places. If you don't have insurance, federally qualified health centers will see you not just for MPV, but for all of your health needs. CDPH operates some STI clinics, and we're doing MPV screening testing. But what I want you to do is give us a call, 312-746-4835, and we will help you get connected to a provider. Most providers are doing testing through their traditional laboratory networks. So, for example, if you go to your doctor and your doctor normally sends tests through Quest, like if you get your blood drawn or you get a swab of your throat and it gets sent through Quest or LabCorp or one of the other commercial labs, that's the same way that it would happen here. If there are people who are uninsured, we can also accept those samples at the public health lab. And so the settings that see a lot of people who are uninsured know how to make that connection. But it all has to be done through a provider. You cannot just go to a laboratory to get a test. So give us a call if you're not sure where to go, and we will get you connected right away to a provider and work on getting you the testing that you need. All right, a couple things on vaccine here. DS Shin from Facebook says, hello, I'm curious when CDPH will be able to expand monkeypox vaccination eligibility and who the next eligible group will be. And Rachel Edwards from Facebook says, do you have vaccine information? A friend of mine said people were waiting in line for hours. Yeah, so these are combined together a little bit. So first of all, Rachel, we'll start with yours. So we have seen people waiting in line for hours. We are trying very, very hard with all of the providers to instead get people appointments, just to cut down on this standing in line for 6 hours and 8 hours, et cetera. That is already getting better, I will tell you. I'm not saying at all it is solved, but especially in the first few weeks when we had only 5,000 doses to go across all of our clinical settings, all of our high-risk settings, we were seeing a lot of this. I expect, and to DS Shin's question, what's happening with timing and what's happening with vaccine? So going from 5,000 to 15,000 has already helped a lot, I will tell you, this week. But we are still seeing appointments get filled up right away. As soon as we are posting appointments, within minutes, they are gone. And that tells us there's still a lot more demand than supply. So When this next batch gets here, this next 13,000, which again I expect in the next 1 to 2 weeks or so, just like we've been all along, we'll be pushing those out quickly. We are doing some planning. For example, CDPH is already doing some vaccinating directly, including through STI clinics, et cetera, by appointment. We have settings where, again, if you're seeing a provider high risk, we're using systems to make sure that people who meet those highest risk requirements are getting the vaccine. But I anticipate that we will do some larger vaccination events when we have more vaccine. And in terms of exactly how the eligibility will open, I don't know for sure just yet, because we are still really seeing a lot of people with these highest risk factors filling up. So. And we want to see how the epidemiology of the disease is going. You know, when CDPH calls and does the case investigation with all of our cases, our goal there is not to, get into your business, but to really understand where are we seeing spread, how are we seeing spread. It helps us answer a lot of questions. And, there's been a lot of reassuring data that we've been collecting too. In Chicago, across the US, really across Europe at this point, I am not aware of a single person, for example, who has been diagnosed with MPV after an occupational exposure, like a healthcare worker taking care of someone. We've had people here in Chicago, had healthcare workers, especially in the early days before there was quite as much knowledge. We had people who were taking care of MPV patients and not wearing PPE, which is not appropriate because we also have COVID and people should have PPE. But we know folks sometimes might not have all of their gloves or their masks, et cetera, on. And even those individuals, we've not seen any spread of MPV. And so collecting that kind of information helps us not only understand who is at risk, but it helps us understand who is at less risk. So certainly more to come there. The CDC is doing some larger investigations, as are other partners around the world, but we will certainly let you know. I'm pretty confident that the next 13,000, we won't be widening, I don't think, at all the eligibility requirements yet. And then we'll be playing this match of second doses versus widening eligibility. So we'll let you know, but I don't anticipate a widening of eligibility in the next couple of weeks, and we'll get a sense after that. Good questions, both of you. Francie Swidler from Facebook. How has MPV or monkeypox affected Chicago's hospital capacity? Is that something doctors are concerned about? I've heard that some of the symptoms and sores can be really painful and people need to seek treatment at hospitals for that. Yeah, really good question. So we are posting every day now on our website our preliminary numbers for how many of our Chicago residents diagnosed with MPV have needed to be hospitalized. So of the 434, I believe, cases that have been diagnosed to date, 20 of them have needed hospitalization. So that's about 5%, about 1 in 20, give or take. And that's actually been pretty consistent with what we're seeing, what we've been seeing all along, what we've been seeing across the US, around the world. And so the good news is 20 patients over the last 10 weeks doesn't threaten our healthcare capacity at all. It's a much lower number than the number of people who are still being admitted to the hospital with COVID, right? Even though that's much lower. For COVID, I showed this earlier, we're averaging about 25 Chicagoans every day still being admitted to the hospital, right? Now that's way down from the thousands, that were admitted earlier, but still there's some more potential for strain. So we're not worried about, at this point, strain on the healthcare system. Thankfully, we've not seen deaths in Chicago, and deaths remain very rare. Where we have seen that with MPV, at least to date, there have been just a handful. It's in people who have other immunocompromising conditions, getting treated for a cancer, et cetera. So still learning about that. But at the moment, I don't at all want to minimize it. They really can be painful, especially when the sores are inside the body. If people are having them, in the mouth or inside, and mostly where folks are admitted, it's been for some of this pain control. But no, not threatening healthcare capacity. Charlie's asking, is the city going to declare MPV an emergency like the state or Pritzker did? So yeah, so let's talk about that. Yesterday, the state, Governor Pritzker, declared a emergency at the state level for MPV. And CDPH, definitely we are supportive of that, but we do not need to declare MPV an emergency separately here in the city, and let me sort of explain why. There's a couple reasons why you would declare something an emergency. One is potentially to increase awareness, and also to potentially increase awareness at the federal level, because if at the federal level an emergency were to be declared, we could, for example, potentially see invoking, the Defense Production Act, or other, there could be some other things related to resources, et cetera, that could potentially help. And so seeing states like Illinois do this, I think, also helps inform the national conversation. But here in Chicago, number one, we are covered by the state declaration. There's not a legal need. And the main reason, I think, why the state has done this, and I think it's absolutely appropriate, anything that helps with efficiency and equity is a good thing. And so at the state level, when they pass this, for example, it lets them pull in the Illinois Emergency Management Authority, the IEMA, that can help if there needs to be large-scale storage or distribution of materials. It lets them use emergency procurement processes. So, for example, if you need to quickly hire people to transport vaccine or do other things, you can do that in a way that lets you move faster than typical government procurement processes. So these are all good reasons to do it. At the city level, again, we're covered by that state declaration, but also we already have actually a pretty good emergency procurement coverage in place. We also already have a strong distribution network. We don't have all of the geography, of course, that the state has to cover. And then we've got a diverse group of clinical and community partners that are really working hard to raise awareness and vaccinate Chicagoans. So we certainly welcomed and we're supportive of that declaration, but we don't need to do a separate declaration here in Chicago. And if at any point we were seeing an administrative barrier that we needed to do that we would do so. But even during COVID, for the most part, we've been able to legally use some of those state declarations or national declarations. And when I can keep things simpler from a legal perspective, that is always a goal, as long as we have what we need. And right now, from a legal perspective, we have what we need. What we really need is more vaccine. And that is just a challenge because there isn't more. It's not like the federal government is sitting on a lot of vaccine. They are also working hard and fast to get more of this, but that is the biggest gap. And so I don't see this at all as kind of pointing fingers. I see it as raising awareness and concern in the epicenter of the outbreak here in Chicago. Let's see. Let's take a couple of COVID questions here. Jean Brooks from Facebook. Are the folks that are requiring hospitalization still largely unvaccinated? So you can actually look at this. If you go to chi.gov/COVID-, let me just pull it up and I'll tell you what the actual number is. And then down at the bottom, if you click on vaccine effectiveness, yeah. So could we pull this up so I can show folks where it is? Do you mind? Thank you. Good. So I'll just show you how I got there. I went to our regular chi.gov /COVID dash page, okay, which is loading here, okay, like I showed you. And then down at the bottom, this is where you can click if you want to know more about what's happening with hospital capacity, like someone was asking, although that was for MPV, it gives you a sense for COVID, what's happening across the country, with community transmission, what's happening with wastewater, what's happening with variants, what's happening with vaccine coverage. And then this vaccine effectiveness, let me click on it and show you. This is about Chicago data for cases, hospitalizations, and deaths. And so it defaults to deaths. But if we go to hospitalizations here, what this is showing you is in red line, Chicagoans who are being hospitalized with COVID who are unvaccinated, versus in the light blue, Chicagoans who are being hospitalized who are fully vaccinated, and then in dark blue, Chicagoans who are being hospitalized who are boosted. And so you can see we do have some in all of those categories, especially if people are getting hospitalized and they're boosted. Pretty much we're seeing folks be older and or have significant underlying conditions. But overall, you know, we turn these into numbers at the bottom. Since the Omicron variant became dominant in Chicago, unvaccinated people have been more than twice as likely to be hospitalized with COVID compared to fully vaccinated people. And then since the variant became dominant in Chicago, unvaccinated people have had almost 3.5 times the risk of being hospitalized compared to people who were not just vaccinated but boosted. And so you can follow along here and see what it's looked like at different points. You know, during the major surge, you can see in red, folks who were unvaccinated were by far the majority, and also that there was a lot of additional protection from people who had the booster in the dark blue line versus the light blue. But we update these once a week, but you can follow them. If you want to see what's happening with deaths, you know, same thing, and feel free to explore that. So good question. There are still, you know, most people are now vaccinated. We can come off that. Most people are now vaccinated, and so by the numbers, there are more people who may be hospitalized than previously who are vaccinated. But still, the rate among people who are unvaccinated versus vaccinated is higher. You are almost twice as likely still in Chicago, right, since the beginning of Omicron, to be hospitalized than people who are vaccinated. All right, Drake Means on Facebook says, I haven't gotten my 2 COVID shots and 1 booster. Should I wait to get my 4th one? I don't quite understand your question, Drake. Maybe you mean I've gotten my 2 COVID shots and 1 booster. Should I wait to get my 4th one? If you are over 50, you should get your 4th one, your 2nd booster now. I do not recommend anybody waiting to get any booster that they are recommended to get. So if you have not had your first shots and a booster, you should get that booster now. And if you're over 50 and you're due for a 2nd booster, I would also get that now. In no way does that limit you from getting the updated vaccine. And I see Lisa Pataki's question on Facebook, what's the timeline of the new vaccine? I don't have official I don't have an official timeline yet, but I've been watching this obviously very closely, and we're seeing some of the companies feel like it may be mid to late September even when that updated vaccine may be available. That's not a promise yet. This is an estimate, but I was estimating that it would be more like October or even November, but it sounds like it's possible. They, of course, are putting a lot of additional resources into this. That updated vaccine could be available as soon as September. We don't want people getting a booster followed immediately by an updated vaccine, so that's another reason not to wait. Get your booster now. And then that updated vaccine, which will better cover maybe as soon as next month. We will certainly have more about that, including data, including exactly who it's for, timeline, you know, all of that. Each week, I expect I will probably have more information to share. But that was good news to me that it could be sooner. I will tell you, though, practically, I'm a little worried about September because I'm excited about having a new COVID vaccine that's updated that will help, and we're going to want everybody to get that. But September is traditionally a month that CDPH spends a lot of time getting children caught up on their regular back-to-school vaccines. You know, there are requirements, setting aside COVID for a moment, making sure that kids have had their MMR, all these other vaccines. And often August, September, October, this is a busy time for back to school. And so please, if your kids are not up to date with their routine vaccines, we saw that happen more often during COVID, do that now, because we've got to put resources into catching the kids up for school. We've got to put resources, that is often the beginning of our flu campaign tends to sort of start to kick off in the September, October timeframe. That's a big demand. If we're thinking about MPV vaccination on top of this in a way that might grow, and then also on top of that, the vaccine that I think there will probably be quite a lot of demand around for an updated COVID vaccine, that is going to be a lot of vaccination need here in Chicago. So I would just encourage you, to try to get anything out of the way ahead of that time that you're able to. That would include COVID boosters or COVID first or second shots. Do all that now. Don't wait. Get your kids up to date now, please, with back to school. Our caravan has been, doing this work at schools. If you've got questions about that, you can give us a call. And then as more MPV is coming, that one I'm not concerned about demand, but we will be, another reason to get as much of that out as quickly as we can is that I want to maintain some capacity for those other big lifts. So we're doing a lot of planning around that. I want to be clear that we have at this point not received a single dime for MPV from Response, like from anywhere. And I don't actually need funding as much as I need more flexibility in the funding that has already been awarded to CDPH for COVID, for example. I would like to be able to direct some of that funding to cover MPV, but currently the way that our federal funding has come, we're not allowed to do that. And so this is some of the conversation at the federal level. I really appreciate they're taking it really seriously. They're working on this, but I am worried about how, as a city health department, we are going to pay for all of those vaccine campaigns on top of each other, in the same month, if there's not some more flexibility. So that's another part of the conversation. If there's an emergency declaration, perhaps we might have some ability to redirect funds towards what's needed. So lots of planning happening. My team is very much on it, as always. Okay, Helen Scott on Facebook says, my husband and 2-year-old daughter and I are all vaccinated. We're noticing Chicago at large is no longer practicing pandemic mitigations. Is there a way to find out prior to if we get COVID that we would have severe illness or death? Yeah, good question, Helen. So first of all, if you are all vaccinated and you have a 2-year-old daughter, that suggests to me that you are not over 65. Your risk of severe illness or death is really low to start with. If you are fully up to date, I would hope that everybody has gotten all the vaccines that they are due for. There is not a test or a way to for sure be able to predict who would get seriously ill. I wish we had that. I wish we had a titer, which is when you can take someone's blood, like for measles. I can check your blood and know if you have a high enough level of antibodies to be protected against measles. We do not have a test that does that in a way that's been validated or that means anything clinically at this point yet for COVID. So I would say that if you are all relatively healthy without significant serious underlying immune functions and you're all up to date with your vaccines, your risk of serious illness or death is low. I hope that is reassuring. But you are right that we are seeing fewer people in Chicago wearing those masks and doing some of the other things. I certainly continue to be careful. We're at a high level. Most people on the L I see continuing to wear masks every day, but not all. Alexandria Deanne on Facebook, is there anything I can take for my sore throat at home or over-the-counter medicine that can help with milder COVID symptoms? Yeah, I recommend Tylenol or ibuprofen to help with throats, with fevers. I think you know best probably what has soothed your own sore throat, but the over-the-counter stuff can be quite good. So don't be afraid of taking over-the-counter, cough drops or cold and flu medication, or especially Tylenol or ibuprofen, assuming that you don't have some other condition where you shouldn't take those. And talk to your doctor. If you are having COVID, I want you in touch with your doctor's office, mostly to make sure that you or anybody doesn't need Paxlovid, right? When I've had family members who are older get COVID, I work to make sure they get that Paxlovid because I want them to have that extra level of protection. But also, I want them in touch with their doctor in case, they're starting to have trouble. And that's a perfectly good question to ask your doctor, especially if you've been told, not to take ibuprofen in the past. But generally, over-the-counters are going to be just fine. All right, and I've got one very random question here that we're going to end with because we actually do know the answers. Jesse James Oliveris from Facebook says, I have a question about these free bikes. So I think you are referring, I actually was at an event and sitting with the Chicago Department of Transportation Commissioner, Gia Biaggi, and she was saying that there's been an amazing demand for their free bikes program. They run a program called Bike Chicago, and they're distributing 5,000 free bicycles as well as safety and maintenance equipment over the course of 4 years to age and income eligible residents. I know they also are training kids to actually build those bikes. It's a really cool program. Online and paper applications, it opened July 18th and it closes August 4th. So you got 2 more days to get it in. Doesn't matter if you do paper or online. They're getting ordered by the date submitted or postmarked, and there is some eligibility. So go to chicago.gov/bikechicago if you want to hear more about this. It's not just kids, but there are some age and then there are some income requirements too. And I would encourage you, I know a lot of people have already applied, but put your name in, because this is something that I think, frankly, CDOT and CDPH were both really pleased to see how many folks are interested in getting a free bike. And it may be the sort of thing that, if we're able to get some additional funding or support for, maybe it's something we can even grow. So if you are eligible on the website, I encourage you to apply. And as the city and CDOT are working to make biking even safer in Chicago, right? They've put in a lot of new bike lanes. They're going to be putting more of those barriers up in between bike lanes and the street. Bikes are an excellent form of transportation from an environmental standpoint. They're also excellent for people getting exercise. And CDPH is super supportive of this effort and have been pleased to see the interest. So you've got till the 4th, chicago.gov/bikechicago. All right, so thank you all for your questions. If we did not get to it today, we will come back and get it. Just Melanie Taylor, I'm just seeing this one quickly on Facebook, says, I've been reading bits and pieces about polio detected in New York. Is there cause for concern here? Does swimming at beaches pose any risk here in Lake Michigan? No, not at this time. We had the first polio case in over a decade diagnosed in an unvaccinated adult out in New York. That is big news. From a public health standpoint, this is a disease that we've not had to worry about. But no, we've not detected issues with it, and I don't have concerns about people swimming. I do have concerns about people not being up to date with vaccines. And so, again, the reason to make sure everybody's up to date with all of their traditional vaccines is we don't want these diseases of the past coming back again. So where they've seen it in the wastewater a little bit was in the UK too. So this is definitely, it's not a major concern. It's not a local concern at this point, but it's just a reminder that we have safe and effective tools that have helped keep us safe from diseases for decades and decades, and we want people to keep using those tools. Okay, if we didn't get to you otherwise, we will be back. So next Tuesday, I will be on with CEO Martinez, barring any changes from CPS. And then I just want to note the following week, we actually are not going to have a show. I am going to be out on vacation, hopefully. So next week will be your chance for a couple of weeks to get questions in. But knowing that we're getting closer to school starting, that is going to be the primary focus. And then we've got some exciting guests coming up in some of the weeks after that around substance use and some other questions that people have had lots to talk about. So really appreciate, as always, your attention and your questions. Check out our website. We continue to update it really every day, chicago.gov/MPV or chicago.gov/monkeypox if you've got those questions or thoughts. And as more vaccine gets here, we are pushing it out as fast as it gets here, but be aware, and as always, be safe, Chicago. See you soon.